Right, right. And so last question for you, because I know you're taking time out of your lunch break. Talking about healing, talking about time frames, you just referenced 2 years for the lymphatic system. Um, what has been your experience? And I've seen varying studies and I've seen research in multiple areas. But if somebody is just not getting the range of motion that they want, that they expected, especially as we see patients younger and younger having total knee replacements, 40s and 50s. Um, if we pass that 12-week mark, and maybe the surgeon chooses not to do a manipulation under anesthesia, patients now 6 months, 9 months, 12 months down the road, um, what are your thoughts on, can they continue to improve range of motion? Should they consider either some sort of debridement or some sort of manipulation under anesthesia without going into into the joint space itself? What are your thoughts on somebody who's 12 months post-op and still limited in range of motion to 90, maybe 100 degrees of flexion, and they need more?
So I think in that instance, as long as the knee is doing okay in terms of the prosthetic, then I think at 12 months, then I do encourage folks to actually look at a manipulation or anesthesia. If they don't want to do that, then I will offer them more of a dynamic flexion splint to use throughout the day, just to try to increase maybe 5 to 10 degrees. That will make them more functional. And we do that for maybe 6 to 8 weeks to see if that helps. And then if it doesn't, then I'm really more apt to say, I think you need to consider manipulation or anesthesia. From what I've seen in terms of doing any arthroscopic debridement of scar tissue, it doesn't work very well. It just produces more scar and then it makes it worse over time. So, but I do think a manipulation or anesthesia, not very aggressive, but it does regain some of that motion back. But I do try dynamic flexion splinting at times as well.
Right. And you just made me think of one more topic that I wanted to ask you about. So in terms of manipulation under anesthesia, I have seen clients respond phenomenally where they were at, 90 degrees of flexion. They get the manipulation. They come to me the same day or the next day, and they're at 120 and they never look back. They just continue to improve. But I've also had cases in which the individual was at 90 degrees. They get the manipulation. They achieve 120 during the manipulation. And then within 24 hours, they're back to maybe 98 or 100. And then by 48 hours, they're back to 90 degrees. Now, my position has always been, and I'm asking you as the expert, you can't form a contracture or scar tissue in 24 or 48 hours to the point that you lose all of the benefit that you originally gained during the manipulation. And the fact that they lose it so quickly, I believe a lot of it is almost like a subconscious response within the joint, associated with pain, associated with fear, with anxiety, with guarding, that your brain, your body just won't let you bend the knee no matter how much you want to, no matter how much you try to. It's not scar tissue that's limiting it. It's almost like a reflexive response that's limiting it in a situation like that. Do you have any experience? Have you seen any scenarios, or what is your understanding of what could a person expect in terms of time frame for scar tissue development that would lead to a contracture versus just the nervous system will not let you bend the knee because it's too painful or you're too fearful? Any information on that would be awesome.
Yeah, so that's a good question. So scar tissue typically takes at least 6 to 8 weeks to really form a decent amount of bridging to limit motion. And if it's before that, then we do know it's more of probably a neuromuscular control, to where they do get a lot of guarding. And so in those instances where, yeah, people do great in the OR, and then, a week later, they're back to where they were. That's where the splinting actually comes into to help, because they have something there that's definitive on their knee that's forcing them to actually move. versus them saying, oh, it's going to hurt, and I don't want to do this. And then the brain just shuts it down again, and then they're back to what they were.
And could you just give people an idea of what your patients have come back to tell you about the splinting? Do they say that it's miserable, it's painful? Do they say that it's not too bad, that it's comfortable? Like, what kind of experiences have you heard?
Yeah. Most people don't like it. It's just uncomfortable because it's a big bulky device. It's not like a normal knee brace. It actually has springs and it forces the knee to bend. So it is uncomfortable, but most of the patients have said it's worked. It's kept their knee at functional level where it doesn't go back to that, 80, 90 degrees of flexion.
And do you, without naming any brand names, do you have any preference between a static splint that you would adjust the pressure and it's going to be a static hold for a certain amount of time versus a dynamic splint that's got some spring to it and is actually pushing the knee into further flexion?
I prefer more of the dynamic. I've just seen it work a little bit better. And I think it's just, from what I have seen, I just like the dynamic a little better than the true static splints.
Awesome. Well, we're done. I don't want to take up any more of your time. You need to get some food in you before your afternoon patients arrive. If somebody wants to get a hold of you, are you still doing telehealth visits?
We are not.
Okay. So if somebody wants to get a hold of you, come into the office, just what's the best way to reach out to you?
Yeah, the best way is just calling our office, Premier Orthopedics in Middletown on Briel, and they'll get the appointment set up.
Perfect. I will go ahead and put the contact information in the show notes and in the description of this video. I just want to say thank you so much. Hang on one second while I wrap this up. So guys, you heard it. Dr. Albright is one of the local experts here. He's the person that I go to with all of my questions that are beyond the scope of, my experience level. And so if you need more information, if you just want peace of mind, if you want to bounce ideas around or get non-surgical treatment for the conditions that you're dealing with, really, he's the person that I would go to, that I would recommend. Other than that, if you have questions, his contact information will be in the description down below. Thanks so much for watching.